Hi, and welcome to Psychology Bites, the psychology podcast with bites of information about psychology with Dr. Cindy Edens. Thank you for tuning in to our first episode. I'm your host, Heather Edens, giving you access to the best information about mental health that you need to know. I have Dr. Edens here with me, and yes, we are related. She is my mother-in-law. Dr. Edens, why don't you start off by telling us a little bit about yourself, your credentials, and why you want to do this podcast?
Thank you, Heather. So I do have a PhD in educational psychology. I teach college courses, so I utilize that degree for that. I have a master's degree in marriage and family counseling, and I do see clients just telehealth now, inside only. And I'm licensed in the state of Georgia for counseling as a licensed professional counselor, LPC. I've been counseling for 20 years, teaching for about 15, and I've had a lot of experience with counseling. I've worked for state entities as well as now in private practice. I've worked in another private practice as well. Anything else?
I think that covers it. That sounds great. So for our viewers here, you may hear me refer to Dr. Edens interchangeably as Cindy as well. So just so we don't get confused, same person, Cindy and Dr. Edens. So let's dive right into today's topic, medical doctors versus psychologists, or more catchy way to say it, MDs versus PhDs. This can be kind of a controversial topic, so I just want to start out by saying that if you are a medical doctor, don't take this personally. We're just going to be discussing the basics, some bad experiences that we are aware of that have happened in the past, things like that. So what's the difference between a medical doctor and a psychologist? Well, there's a lot. But for this podcast, we're going to specifically talk about why going to a psychologist might be better for your mental health. And what they can do that can help you that a medical trained doctor may not be able to help you with. So Cindy, why don't you give our listeners and viewers a good description of what the basics are between MDs and PhDs and what a person can expect from each one?
So there's a lot there to unpack. Okay, so first of all, MD can be any prescriber. It can be an MD is still going to be an oncologist will be an MD. A pediatrician will first be an MD. A psychiatrist will first be an MD, but they go on to get extra education. So a psychiatrist, for example, has a lot of psychological courses, understands psychology, is specially trained in pharmaceutical medications, and whereas an MD, your regular PCP is normally an internal medicine practitioner, which means they are good at just treating for sinus issues. If you have a heart condition, you might go to them first, and then they would send you to a cardiologist. If you had cancer, you might go to them first, and they refer you to an oncologist. The problem is that, especially in rural areas, and a lot of this has to do with commercials, I feel like, but you go to your PCP, and instead of referring you to the psychiatrist, which is what should be done, they just give you a 5-question questionnaire, seeing if you have anxiety or depression. And there's problems with that because that's not exactly how we diagnose. I brought my DSM-5. This is how we diagnose. We use this book. It has all the different mental health diagnoses in it. I am qualified as an LPC to diagnose any mental health condition except autism and ADHD, because those are both neurological illnesses. And so not a neurologist, they're not trained in this, but a psychologist that's a clinical psychologist. So I am a psychologist, but I'm an educational psychologist. I am not qualified to diagnose ADHD or autism, because while I have taken my testing courses, I haven't gone into the extent that a clinical psychologist has. Nor has he gone into the extent of education and how we learn that I have. So we all have our different specialties, and I think it's just important. I like to always say, stay in your lane. We all should stay in our own lane.
Right. So just for the viewers that don't know, can you explain what the DSM-5 is that you just showed us?
Sure. So, Diagnostic Statistic Manual of Mental Disorders, DSM-5. So, what we do is we use the DSM-5, and so a group of psychologists and psychiatrists get together and update. This is our fifth edition, but it's not really our fifth edition, actually. So, like, there's been lots of different editions. For example, the DSM-3 came out in the 70s, 1973. I'm not sure. Don't quote me on that. But somewhere around there. And it took out homosexuality. And it took out homosexuality as a mental health disorder because the majority of the population no longer saw it as a mental health disorder. One of the criteria for having a mental health disorder that everybody usually forgets when they're at home diagnosing themselves is it has to really interfere with your life. Mm-hmm. It has to go against social norms. And so if once those two things kind of get knocked out, the psychologists update and they knock those diagnoses out as well. We've done that with lots of different diagnoses.
And so this is why it's constantly changing.
It is constantly changing and updating.
Okay. Well, that sounds pretty good. So let's say, just to reiterate that a person has anxiety and they go to their primary care physician for it. Maybe they get diagnosed with anxiety at their primary doctor, even though they maybe just went in for a cold or some other reason. What specifically is the medical doctor going to do from that point?
Well, see, that's where I usually have problems. And yes, this is a pet peeve of mine. And for good reason. I had a friend one time who he was feeling really anxious and suicidal, and he was suicidal because he was anxious, and he couldn't get in to see his psychiatrist or his counselor, and he went to his primary care physician, and his primary care physician only saw the anxiety. He did one of those 5 little questions for depression and anxiety, but it rated really high for anxiety. And so the MD, not being trained in psychology, probably only had my Psych 101 course, didn't understand the extent of his suicidality at the time, and gave him anti-anxiety medications. And so the problem with anti-anxiety medications is it works on our serotonin, which our serotonin is one of our happy neurotransmitters. They make us happy. Mm-hmm. And so if we're too anxious and we're all up and we can't calm, and anti-anxiety helps with that. But if you're super depressed and you're anxious because you're depressed, and yes, anxiety and depression do go hand in hand, that's when it depresses the system. So what happened to him was he came over to our house one evening and he was just all distraught. And he had a pail, he had a rope, he had a knife in his house, in his bedroom, and he was prepared to utilize that. We had to call his father. I'm just thankful that he came to me. But it was 2 weeks after he got put on the anti-anxiety meds, and it just slowed everything down. So then he was really seriously ready to kill himself. I've seen clients who are like severe psychosis, have a severe psychosis of some type, schizophrenia or whatever. There's a lot more psychosis diagnoses than just schizophrenia. And I've seen clients who did have a lot of psychosis go to their PCP for problems. Like there was one girl who kept complaining about her stomach, said she was throwing up every day. She kept telling everybody she was pregnant. She thought she was pregnant because she was having morning sickness every single solitary morning. she ended up having stomach cancer, and nobody diagnosed it until after she was dead.
Wow.
Because the PCP that was in charge of her case when she went to see her doctor thought it was all psychosis. She was just psychotic and thought that she was pregnant, and so everybody dismissed her until she died of stomach cancer.
Wow. Yeah, that's really bad.
I have way more stories too. I mean, it's sad, and I'm not going to sit there and recommend medication to anybody because that's not my specialty. Again, we got to stay in our own lanes.
Right. So on the flip side, if people go to a counselor or maybe their doctor refers them to a counselor, what kinds of things can they expect from their counselor, say for the same diagnosis of anxiety that a medical doctor is not going to do?
So honestly, a lot of times if somebody comes to me and they have a lot of anxiety and they're just like super anxious, I might send them to a psychiatrist. I do ask them to go to a psychiatrist. Some people want to go to their PCP, and it is legal and ethical to go to your PCP for medication as long as the PCP and the counselor are communicating. Because, and I have done that. I have collaborated with MDs before, and that works fine. Because the MD that I talk to the client once a week for an hour, and I know the client, I know the diagnoses. I am qualified and legal in the state of Georgia to diagnose. So we work together as a team, and that works. And in the rural community, a lot of times that happens because you can't get a appointment with a psychiatrist. Sometimes you got to wait months, and that will never do. But so if somebody comes to me from an MD who referred the person to me, or they're so anxious that I refer them to somebody, because in order to start working on coping skills and things to help you with your anxiety, we have to be able to concentrate. You need to be able to concentrate and get all those demons out of your head. And so we work together. It works together pretty good, I think. Once we start in on counseling, so say somebody gets anti-anxiety medication, we just start in on skills. It depends on what somebody's background is and their experiences, their diagnoses, what they like, what they respond to. There's a million different therapeutic techniques, and people probably use lots of different ones. I use very similar ones, and I kind of use them over and over again because they're tried and true, and I like them.
Right. So I just want to take this time to remind everyone that Dr. Edens is still a full-time practicing licensed counselor in the state of Georgia. She has been doing this for many years, as you heard her say earlier. At the end of this episode, if anyone is interested in setting up an appointment with Dr. Edens, I will provide that information at the end of the episode. And so I know that you've kind of told us a little bit about some of the horror stories that you've heard from clients in the past that have been to medical doctors first. Is there any others off the top of your head that you can think of?
Of horror stories or good stories?
Either or.
We got, like success comes, and I try to tell clients this, they can have the life they want. Anybody can. It's just a matter of coming out of our comfort zone to work on it. And I know, and I've seen the stupid little thing that says, that counselors always try to tell people, just get out of bed, get exercise, and you'll feel better if you're depressed. And I understand. I do. I get it, how hard it is to get out of bed. But I liken it to having a warm, wet blanket. You're freezing and you put on this warm, wet blanket and you're warm underneath it, but you're still wet and you're still chilled to the bone, but you don't want to take it off because it's going to be so cold when you do and shocking when you do that you just want to cling on to it. And that's what happens with the depression. We kind of just cling on to it, or the anxiety. It's just how we've always thought. But taking those steps, when people actually take those steps and work with me and work with the skills that I teach them, I have had lots of success stories. Lots of people have moved on and, done wonderful things with their lives and been able to get rid of all those woulda, shoulda, couldas and what ifs kinds of voices in our heads that we all listen to.
I think that's a good analogy, using the warm, wet blanket. I think that will resonate with a lot of people. Um, but so, switching to a little bit different topic, why don't you tell the audience what your clients and your students enjoy the most about you? What's something that attracts everybody to you?
She knows what this answer is already. I'm just going to say, I know what she wants me to say. It's critters. We have a little gizmo here.
We do. I'm not going to pick her up because she does not like being picked up. I think the dogs are playing in the backyard right now.
And
I'll post a picture of them, though.
But yeah, and so when I did work in office, this is prior COVID, admittedly, I don't go office anymore. But when I did work in the office, I had Allie and then Annie. Allie for a while. And then when Allie retired, I had Annie. They overlapped for a little while there. But they were great therapy dogs. And talk about successes. When you have a young girl or a teenager who doesn't want to talk to you because their parents are making you come or court's making you come, it really, really helps to say, okay, fine, it's cool. Let's just play with the dog and sit down and give her a brush or him or whatever. And they can brush the dog and play with the dog and talk to the dog. And through that camaraderie, through that general sharingness with an animal that can love unconditionally, people will start opening up and will start trusting you and understand that they can spill and you're not going to spill.
Absolutely. I think we can agree that therapy dogs are also a very important part of the psychological community these days.
Mm-hmm.
So as a side note, one of the other reasons that we chose the name Bites in our podcast name is because we are going to try to incorporate some of the therapy dogs into some of our episodes. We'll do some videos where you guys get to see them because there's really a lot that you can relate between psychology and the dogs. There's a lot of things that you can teach the dogs that help other people learn about psychology. And Cindy is also a very good dog trainer. She has a lot of experience working with different rescues. And animals are a big part of both of our lives. We look forward to sharing some of that with you as well. We both live on a farm in a more rural area, so we have a lot of animals around here that we can incorporate.
Horses, goats, dogs, cats.
Yes, all
fish
kinds.
Tank, don't forget the fish.
We have ducks.
Chickens and ducks.
Yes. They are so loud. You might actually hear some quacking in the background of some of our videos, and that would be them. But do you have any other comments to add about the dogs in relation to psychology?
I did actually do a lot with animal assisted therapy, and so I actually wrote a program for animal assisted therapy for one of the state run agencies that I used to work for. Kind of had to do it in order to get Allie in to be their therapy dog. But yeah, I mean, I can't tell you how many times. I remember one time in particular that I was called out on the scene for when I was working at the state-run place. They called me and Allie. Technically, they just wanted Allie. Everybody always wanted Allie. And there was a client who was having a total meltdown in the middle of the parking lot. And so I came up and I brought Allie, and I had been working with this client. I knew this client was my client. And so I walked up and brought Allie, and Allie just kind of stepped over her, and she could go like that and just hug Allie. And she just stayed on the ground sitting there hugging Allie for about 15 minutes. And finally she stopped crying and she got up and we talked.
Well, that is really good. Allie working miracles.
Allie did. There's newspaper articles about Allie, and there's all kinds of things about Allie too. She got to go to lots of different DBHDD presentations. We did all kinds of things. NAMI. She spoke at all these different conferences. Although she does have a good inside voice.
All right. Well, we're going to shift gears just a little bit, and we're going to talk about the different types of therapy that you can expect from counseling. You may have heard terms in the past like CBT or DBT, but what do those things really mean? So, Cindy, can you tell us all of the different types of therapy that you can think of, and then we'll try to cover them like one by one.
Yeah, there's a gazillion types of therapy, but so let me just start with the ones that I usually utilize. So I utilize CBT, as you mentioned.
Mm-hmm.
CBT is cognitive behavioral therapy, and CBT allows for helping people to look at things differently. So,
That was a chicken.
for example, when we walk into a room, everybody knows this little story cliche thing. When you walk into a room, everybody stops talking and turns to look at who walks through the door, right? Mm-hmm. And then the person walking through the door is like, oh my God, they're talking about me, because they all just stopped talking. What are they saying? But we also all know that they're not talking about us. In all reality, they probably weren't even thinking about us. But it's our initial kind of fear that we do that. So it's helpful to look at a situation like that and say, like, okay, but if, you're there in a circle and you're the one talking, you probably weren't talking about the person that just walked through the door. You've probably been both people. So kind of using different ways of reframing situations and looking at different situations is basically CBT in a nutshell. Because then when you walk through the door, your behavior is going to be changed too. Because now you're not like, oh my God, what are they talking about me? You're like, hey, how y'all doing? What you talking about? Let me join. It's a lot more open, a lot more easygoing. And so our behavior changes if our thoughts change. DBT is dialectic behavior therapy, and I love dialectic. Dialectic, that word means that two different opposing things can exist at the same time, and that's okay. Mm-hmm. I do this hand motion because it's like a teeter-totter. You can go up and you can go down. Neither way is wrong. Mm-hmm. So I can say I hate my mother and I can say I love my mother, and both statements can be true at the same time, and it's okay. In DBT, there are a lot of skills. And this is what I usually work with people who have like a lot of trauma in their past. I start out with DBT. Even if they came to me for ADHD, autism, just being on the spectrum, or any kind of trauma-based stuff, I'm still going to start with DBT because that just gives the skills. Once we have the skills, then we can go back and process. So DBT comes with like lots of different kinds of skills. I'm actually fortunate enough that I can say that I know Martha Lenihan, the person that developed this program, and she developed DBT originally for personality disorders, particularly borderline personality disorder. However, I kind of tweak it to use it myself for anxiety. And so I teach mindfulness, but I teach it in a different way. I don't teach it like it's not mindful meditation or any of that stuff. People have taken mindfulness and just ran with it because it is such a cool thing. Mm-hmm. And so I teach those skills and some more emotional regulation skills, all that kind of stuff. We actually have a free website I can give people if you can put it on there sometime.
Yeah, I can put that in our resources.
And then of course I don't like Sigmund Freud, not a fan. In all honesty, he was a coke addict. He was.
That's for a different episode.
But it was legal when he used it, so that's, whatever. But psychoanalytic theory, we've kind of tweaked to use what is good from Freud and to dismiss all the rest that was discredited. And so one of the things that I do use is in order to go back and process trauma, we do have to go back and we have to relive those, not really relive, but look through and kind of relive those experiences. And then when we go to sleep at night, we we reprocess those memories with less emotion. And so it helps to process. That's the process for psychoanalytic therapy.
Right.
Those are the main ones I use. I use them interchangeably. Um, and yeah, there's play therapy and all kinds of things. I don't do kids. I love kids and animals way too much. It breaks my heart. I can't do little kids.
Yeah. Yeah. Okay. What would you say is your favorite therapy type? I mean, I know that each client is a case by case basis. You kind of have to, determine what your strategy is going to be with each person. But what would you say that you like to employ the most? I think you kind of touched on that a little bit.
DBT.
Yeah. Okay, so I guess we can touch a little bit on how therapy looks different for everyone. We've covered different therapy types. We've covered the differences between doctors and psychologists, or MDs versus PhDs. And no one is going to go through the same exact therapy treatment as another person, because treatment is designed for each individual to help them out the best. And so, what would you have to add about that?
I'm sorry, about what?
Like how treatment is individualized for each person.
Well, because it depends on what they come for. So, for example, if somebody comes for trauma when they were young and it's affecting their life now, I'm probably going to start with the DBT skills and, utilize some CBT. And we're going to practice with DBT and CBT for a little while to make sure that the skills are being employed correctly and the person is comfortable with them. Then we're going to go back and do the process thing. But some people don't have trauma and don't have to process. So, you just do the skills, you do different things in different ways. Some people might have OCD. OCD, for the record, is just really, really, really strong anxiety, and people misspeak about what people say because they're clean fanatic, they're OCD, but that isn't the diagnostic criteria technically. But yeah.
Right. Okay, so basically, summing everything up, we're not giving legal medical advice. You should definitely make those decisions for yourselves, but just try to take a moment to consider what kind of help that you think you might need and where you should really be going for that kind of help. A psychologist may be able to provide you with more tools to help you in everyday life that a medical doctor might not be able to provide. Medicine is super helpful, and we're not discouraging anyone to stop taking their medicine or to avoid seeking medication for help. We are, however, just trying to make everyone aware of the things that can be most helpful to them. Maybe you need medication and therapy. Maybe you only need therapy, and maybe medication is all you need to feel better. Everyone's case is going to be different. But if you need help, please do seek out treatment in some form. Counseling is covered by almost all insurances these days. And so is telehealth counseling since COVID happened. And so that can be more convenient for people that have busy schedules. There are several different types of therapy, as we talked about. Someone else's therapy experience may not look the same as yours, so you shouldn't just take someone's word for it on how their therapy experience is, because yours is going to be totally and completely different. Your therapy experience is not going to dictate what someone else's experience is like either. And if you go to the same counselor as someone your therapy experience is still not going to be the same, because each person's plan is individualized. So do you have any final notes or words of encouragement for our audience?
Yes, as a matter of fact, I do. So last time you asked me a question, I said, and can you repeat that? Or I'm sorry, and let you know that I missed that question and I didn't know how to respond. Every single one of us gets lost in our thoughts sometimes. I can look at Gizmo sitting there, this cat, their cat, and start thinking about, I should be holding her while Heather's talking. And so I miss the question. We all do that. Mindfulness is when we're concentrating on the moment, and I knew how to answer her question. The beauty of that is always being in the moment. Mindfulness is some powerful stuff.
Absolutely, absolutely. And we'll talk a little bit more about that in later episodes. But that pretty much takes us to the end of our episode. So if any of you guys found anything about this episode interesting, if you want to see more, if you have your own horror stories with doctors or even counselors, let us know in the comments, or reach out to us if you have any questions. Let us know. If you love what Dr. Edens has to say and you want to hear more perspective from her, even on a personal basis, she is accepting new clients at Garden of Eden Counseling. That's what our banner says back here behind us. But she is only registered in the state of Georgia. So you can only see her if you live in Georgia. And if you'd like to contact Garden of Eden Counseling for an appointment with Dr. Edens, I'm going to put that information on the screen at the end. And you can email the company. You don't have to call them. I know that a lot of people don't like to talk on the phone, but you can email us, and you can email us with questions as well about the episode. We're going to try to check that pretty frequently. And so, again, I will post that information at the end, and I will also post the website for Garden of Eden Counseling. The website has a little bit more information about both of us. It has some more information about the therapy dogs and just some more things that you guys might be interested in. So for more information about psychology, more psychology bites, if you will, tune in with us next Sunday for episode 2, where we are going to talk about the realities and truths behind ADHD. So thank you for tuning in to our first episode of Psychology Bites. Have a great week.
Let us know if you want me to be on a horse next time for the next episode.
Okay. Have a great week, everybody.